Welcome everyone to our webinar today. My name is Gary and I'm one of the quality and compliance specialists at Radar Healthcare, a leading software company working with healthcare organisations across quality, audits, incident management, compliance, patient safety and risk management. Here at Radar, we have a strong community within our customer base and we're keen to share knowledge and best practice whenever we can. Today, we are joined by one of our customers, Scott Finnigan, General Manager of Thistle Healthcare Group, who is going to share his experience of digitalising infection control along with some best practice tips. We'll spend around 20 minutes speaking with Scott, and then we'll answer a few of your questions. You'll all also have access to a live question answer feed on the right-hand side of your screen. Please feel free to post your questions there and we'll do our best to answer them during the session. But enough from me, please let me introduce Scott. Scott, could you please tell us a bit about Thistle and your role there?
Yeah, thanks, Gary. Hi everyone, I'm Scott Finnigan, the General Manager of Thistle Healthcare. I have full operational and quality responsibility for the group and oversee the 10 care homes within that group. Thistle is made up of 7 care homes with 2 associate companies which comprise of another 3 which form the 10. Thistle Healthcare is a family-run business. We operate in central Scotland with most of our services in the Lanarkshire area, with 1 in Glasgow and 1 in Dundee.
Thank you, Scott. It goes without saying that infection control has been a huge focus for all of us this year. Could you please give us a quick overview of your infection control processes?
Yeah, so obviously at the beginning of the pandemic, we quickly had to review our processes and checks around infection control. We implemented new COVID-specific audits and checks to focus on cleaning standards, hand washing, PPE. Our services carry out a weekly review by the home manager and cleanliness standards and cleaning processes, very detailed, including looking at things like mattresses, shower chairs, bath hoists, PPE stations, checking the temperatures before someone essential visits come into the service, and also the outdoor visiting procedure that we're all using at the moment. The review comes to me and the senior team for every week for review, where we can deliver any support that's required. Should the service not meet any areas or have any issues implementing guidance, or indeed share good practice where the service is able to demonstrate that they are compliant with the guidance. This is followed up by a monthly operational review, which is carried out by a member of the support team, which is a second check on all the same sort of areas, but a particular focus on preventing an outbreak in the home. We've also devised a mock inspection following the same process of the inspection process as the care inspectorate, which is carried out quarterly in every service. And the management teams in the homes also carry out twice weekly random observation of practice and staff. This is to look at things like ensure PPE has been worn correctly, social distance has been maintained or encouraged where possible, and that the practice in the home is in line with the current guidance for Health Protection Scotland and the governments.
Sounds great. I understand the projects and product specialist team are very supportive and proactive, building bespoke infection control processes for Thistle.
Yeah, absolutely. The team contacted us at the very beginning to say, how can we help? What can we take off you? What do you need to review? Which was very useful because it was a very difficult time, and unlike most care providers, we experienced a couple of outbreaks. So a lot of my time was taken up dealing with that. So it was really comforting to know that I had the support of Radar to help us change our processes and procedures, all the while being able to focus on what we had going on at the time.
Really good. How has digital technology helped you implement these?
So Radar has allowed us to implement these changes really quickly. The system allows changes and alterations, or indeed create something new very quickly. It's meant everyone is using a standardised approach and that nobody is missing any points. We use notice function on Radar to communicate changes, and whether that be guidance from Health Protection Scotland, the Scottish Government, the UK Government, or our internal processes quickly. to everyone in the group, so it means we can see who's read these notifications and who hasn't. Using technology and standard processes allowed us to continually evaluate what we're doing and the information that we're gathering. So making sure that what we are looking at and the information we're gathering is meaningful, and that we're not just gathering it for the sake of gathering information. We've been able to use analytics and reports to evidence why changes are needed, or indeed why we need to keep things because things are working well. Obviously, a lot more people are working remotely than we've ever been used to, and that's the same for me. So Radar's allowed me and my team to maintain overview of all the services without relying on massive information being shared via email. The information is live, it's accessible, and the nature of Radar allows us to look at events and audits within a service at the same time as the service if they were having any issues answering the questions or unsure about the level of detail that was required.
That's fantastic. Due to Radar being fully mobile friendly, working on any device must add loads of flexibility to your team, especially with people working remotely and from home, ability of accessing via a mobile or tablet.
Yeah, absolutely. A lot more of the team, including the teams in the services, to be fair, using things like tablets for a lot of reasons, but they're easier to clean than keyboards and computers and things. And obviously the remote support team and sort of director levels were able to work remotely using all sorts of different devices. So I personally use Radar on my mobile phone sometimes, depending on the situation. I use it on my laptop if I've got my laptop open, and my iPad. It means that we can access the information really easy. So it's not the first time I've been asked a question where I log on my phone to look at Radar to find out some information that we needed.
Excellent. Regulation is obviously a huge part of healthcare, and we know that the Care Inspector of Scotland has introduced a new key question. How good is our care and support during the COVID-19 pandemic? We expect that the CQC and Care Inspector in Scotland and Wales will also be asking questions around COVID in some form or another. So could you tell us a bit about how you will be evidencing this?
Yeah, so as you mentioned there, Gary, at the Care Inspectorate have developed a new key question, which is key question 7. So it's made up of three specific areas. So 7.1 is about health and well-being of the resident group. 7.2 is about infection control practices, processes and procedures, and 7.3 is looking at staffing arrangements and how responsive are staffing. So we've been able to evidence infection control checks via Radar, looking at our weekly service management reviews, monthly operational reviews, and our random observations of practice. Giving a good picture of how we monitor practice, what we do when we find something that isn't quite right. So we've got the evidence of the actions that we've taken and also the follow-up to them. Provides a picture for individual staff performance, which is able to be picked up as part of supervision if that's needed. Practice in relation to guidance has been our main focus since we started using Radar, but obviously a bigger focus now on the current pandemic runabout infection control practices. So it's always been a foundation of our quality improvement processes. We've made them very specific at the moment, solely focusing on the current pandemic and ensuring that our teams are practicing safely and in line with the ever-changing guidance, because it can be difficult to keep up with at times. Our audits have been specifically developed around the key questions and the guidance for Health Protection Scotland and Scottish Government. Focused practice, PPE usage, cleanliness, what action we'd take if there was a suspected case in the home, and also monitoring performance when there was an outbreak. Did we follow the right processes and procedures? We also monitor infections on Radar, so every infection that there is in the home, no matter what it be, is logged on Radar. That includes any suspected or confirmed cases of COVID-19. So we update that every few days. It gives us a good picture for each individual resident and provides really good evidence on reviewing the resident's condition, any medical interventions that were required, any advice for medical professionals, and of course any sort of updates provided to the family of the resident. Services in Scotland are also being inspected by the local health and social care partnerships. These are audited audit focused inspections, sorry, and usually from the health side of the partnership, so people like advanced nurse practitioners, care home liaison teams, and usually somebody for the infection control team for the relevant NHS board. Any inspection that we carry out in the service, we log on Radar as inspection feedback. We carry out a lessons learned, and then we cascade this across the group to allow all services to learn from an individual inspection, which also allows us to look at and continually evaluate our quality improvement processes. We did recently have two care inspector inspections in the past few weeks, where from the feedback that we got from this, we actually changed some of our audit processes. Because the inspections are very new to everybody, there was a couple of areas that we felt we could probably make a bit more robust. So from that feedback, we did make some changes, which were very positive in the eyes of the inspectorate, that the system could be so easily configured.
You have raised some great points. With audits forming a key part to your business processes, artificial intelligence, AI, and machine learning that Radar uses in the form of its analytics tool must add a lot of value to your business, giving you all instant updates and notifications, telling you what's not right, what needs your urgent attention, allowing you then to make quick responses and updates for the care inspectorate.
Yeah, absolutely. It's allowed us to work very proactively when something does happen, rather than reacting to be a day down the line to finding out lots of key information. So the way the system works, it's learning, and also the analytics that are as a live data report makes all that really easy, which means you can get information to share really quickly. So if you ever were presented with a question that you didn't weren't completely sure of the answer, or you felt you needed to update some information on it, you could very quickly get that information off.
The focus on COVID is expected to continue well into 2021, but infection control will always be a key focus for care providers. How are you continuing to monitor the Thistle's infection control processes over the different locations?
Yeah, so as you mentioned there, Gary, it's always been a focus for care providers and care services, although probably now we're allocating a higher proportion of time to this. So as I briefly mentioned there, we use analytics and reports for the inputs that we put into Radar. This informs the senior team meeting and also informs my board reports. So the senior team meet weekly, we review the audits, inspections, infection events, things like that happen in the service for the previous week. We then share any learning and implement any plans for support or guidance that might be required about that, or sharing really good evidence of best practice that the service is demonstrating. We use the data gathered in Radar to look at trends across the group and individual services for our self-evaluation and about our performance. Whether that be looking at a specific training need, or tailoring a specific audit question, or looking at action plans, or of course sharing a good practice across the whole team. Since March, as I've mentioned, we've changed a lot of parts of our processes, specifically around about infection control, due to the changes in guidance and how we should be doing things now. We've learned a lot, as I'm sure a lot of care providers have, which have meant we're able to change our practice and processes really quickly. I use all this information that we gather as part of my catch-ups with the relationship manager for the care inspectorate, meaning I'm able to provide really good detailed responses on every service, as well as for a group perspective, which I know definitely gives external reassurances that our quality improvement processes are robust.
That's really interesting to hear about how you investigate trends. Must add real value to Thistle.
Yeah, absolutely. I mean, without being able to evaluate trends, you don't know why things are happening. You're unable to sort of make changes and evaluate if you can't look at things like trends. So it's a really important part for us.
Brilliant. Data and reporting is also essential parts of care, and we know that having the right information available can be a challenge for any care home. How do you build reports to make sure your board and team have the data they need?
So as I've mentioned, I do use analytics and the report function. I probably use this daily, usually focusing on different things each day or each week. It's really easy to configure, meaning that I'm only pulling off the information that I really need. So I'm only sharing pertinent information with the team or with the board, so that important information doesn't get lost in a sea of data like previously. We have weekly Teams meetings with the whole management team, in which we share the data at a group level and individual performance. We also share this stuff through our notices, allowing a clear, open, transparent system and the ability to share learning across the group with the whole 900 plus staff. So that's really beneficial, so everybody gets the same information. Every service has a quarterly 360 review, which will look at clinical and operational KPIs. Obviously, infection control has become a bigger part of that. And we use the reports and analytics to drill down into the smallest detail to allow us to ask questions and offer any support a service might need. From this, we do look at trends. So for example, things like infections. We then look at how the service has performed in audits and inspections, as specifically around infection control, and we can look at trends in relation to how did they perform in the audit and what is their sort of figures on about how many infections has there been, what kind of infections are they, so we can provide support, targets, or very clear actions for the home. I use all this information then to provide the board report, which obviously I'm confident is very accurate with all these functions that Radar has and the information that the team provide, so that I can provide explanations for the data, but also share the good practice that we see across our homes and where required any additional support that any service is receiving.
Reviewing what we've discussed so far, sounds like Radar has quite an impact on your business. Data available at your fingertips, KPI reports, a system that is easy to access and retrieve information when you need to.
Absolutely, Radar has completely transformed the way we operate as a team, operationally as well as for a quality perspective. So it really has changed how the organisation gather, report, and use information.
Brilliant. We know that moving to digital processes could seem like a big job for care homes who are currently using manual methods. What advice or tips do you have for them?
So you're right there, Gary. It is a big job, and I think the most important piece of advice to give is really that take the time to build a system that meets your specific needs. So tailor it to what you need to get out the system. It does take a lot of time initially, however, in the long run, it will save you so much time. I used to spend roughly 11-12 hours a week reviewing information and data via emails, pulling reports together, picking out the most important information, and now I can get this information in half an hour, which massively cuts down the admin time, which allows me and my team to be freed up for developmental work and support. We're nearly 2 years into using Radar, and we continually build on what we use it for. So making changes to our current processes, once it's all built, it's really easy and simple to make any changes.
Sounds great, Scott. Must be very reassuring when you know that you can adjust or build a new process and workflows when you need to. Total flexibility for Thistle now and also for the future.
Absolutely, and that was our main focus on about using Radar, was the flexibility that we had to tailor it specific to us, and also knowing should we need to make a change in the future or should something need developed, then we could do that at whatever pace we felt was required.
Okay, we'll start to wrap things up now, but thank you for all your questions. We'll answer the rest and publish them in the coming days. Scott, thank you again for sharing your expertise with us, and thank you for everyone for joining us today. We'll be running more webinars like this one in the coming months, so drop us a line to let us know your feedback or any other topics you'd like us to cover. Bye for now.